Bon Secours Mercy Health was a newly merged organization in 2018. I worked for our Chief Nurse Officer for Nursing Practice Education and Research. We had a variety of clinical ladders across our organization, which spans several states. And there was a desire and a drive to try to elevate the level of our clinical ladders and to create a system ladder that was really tied to our nursing strategic plan and our KPIs. So when we started this journey, it was me kind of, Googling it, as you will, trying to find a vendor that had a digital platform. There really was nobody on the scene outside of StaffGarden. Tentatively reached out saying we're looking, because currently everything is in paper, binders, sitting on somebody's office floor. The first one was our HR team. Because there would be data for staff living in a system that was not internal to Bon Secours Mercy Health. It was also our chief nurses, because the way that our company is structured, our health system, the cost is going to come out of their budget, not a system level cost center. So it was engaging all of those individuals and helping them to see the value and the vision of a digitized platform, and also having to do some due diligence, particularly where our HR was concerned. StaffGarden had already done a Workday integration, also ensuring that they did their due diligence because they thought they had a potential solution internally, but when we explained to them the comprehensiveness of what we needed, it was really quickly apparent that you can't build that in our current systems. When we talked about budget, in particular the cost of the program, we had an internal consultant group working with us, and we worked with them for a very long time and built out an ROI model where we were able to use current clinical ladder participation, the cost of the new program in terms of the bonuses that nurses would get, along with the cost of StaffGarden, and then project. You would need to, it would say, well, based on that, if you retain 3 nurses, you've completely covered the cost of the program. The element that we were clearly missing in our organization was reportability, because even if you digitize a platform but there's no reporting capability, then all you've done is digitize information and people are still having to mine it. I also oversee Magnet for our organization, so having the ability to pull out and get to the rich data and all the work that our nurses are doing, looking at synergy across our system and how that's correlating to improvements, was a huge selling point. And that was also a huge selling point for our chief nurse officer. The fact that StaffGarden was willing to take our vision and implement it and not have us try to fit a square peg in a round hole, if you will. It wasn't a predetermined sort of template of what that looks like, was also huge. They can access it from their phones. They can access it from a computer, from an iPad, from a laptop. Documents, if they're going to be attaching something, can easily be uploaded. There are templates that are easy for them to complete. All of the information is contained within that. And then I think the other element for nurses is once they complete it there, it is going to cross over in terms of completion and success into our HR system. So they're not going to have to do any kind of duplicative work in order for something that is done here to show up in their HR and their profile. So that is going to be a really seamless process, which when you're talking about paying people is huge, to make sure that they are being rewarded and recognized for the work that they've done. Find your key stakeholders, find brilliant partners, find a team, find an equally engaged partner who has the same vision. Together you can problem solve and identify ways to overcome maybe barriers or gaps that you're having in the process. And I would say tenacity. It's going to be a long project in some sites, so you just really have to have belief that you know it's going to be the right thing to do, because in the end it's going to serve not only our organization, but it's really going to support our nurses and help us to give the recognition that they deserve. Brian Card has been one of the most phenomenal partners as a vendor in my almost 40 years of nursing experience that I have had to work with. He was constantly engaged in spite of barriers and obstacles, working to even help us as we think through things, providing us updates on other health systems who are engaging that, again, would continue to spark our internal discussion and help us to think about a different way to approach it, to get approval or to pilot, etc. Being able to track this data was another huge element. We really highlighted the gap that we have in actually knowing how many are on a clinical ladder, and being able to tie recruitment retention into a digital platform that was now going to give us that in great detail. It was the most seamless, painless process. Experts, competent, follow-up and follow-through, phenomenal, absolutely phenomenal. I also think they have vision and ideas. They're able to inform you as you're building your structure on their platform, ways that may work better for you, ways that they've seen work better that you hadn't even thought of, because I don't do IT, I don't build platforms, but they have ideas as a vendor to say, well, consider this. This might actually be even better. And you're like, wow, that isn't even, you built a better mousetrap. That's a great idea. So I think when you're thinking about that, it's not just, can they do what you want, but are they bringing expertise to the table that's going to elevate what you're trying to accomplish? And I feel like they've really been able to do that with us.